Hello, and welcome to the October 9th, 2022 episode of the Public Health Link. I'm your host, Marisa Salisbury. As usual, tonight's episode is jam-packed full of actionable items. So for our action agenda, we're going to talk about an FDA alert that was issued over gummies containing nicotine. We're going to discuss a program in Denver aimed at eliminating mental health stigma. And we're going to talk about an alert issued by the Michigan Department of Agriculture and Rural Development. For our Tech Corner, we're going to talk about tattoos. And let's not forget our public health event and our pH meter. Before we go on to the rest of our episode, I just want to remind you real quick about hitting subscribe. By subscribing to the Public Health Link, you're alerted whenever our episodes are released on Sunday evening, as well as if there's any special reports during the week. In addition, if you find they have questions or suggestions for future episodes, don't forget you can email us at thepublichealthlink@gmail.com. Again, that email is thepublichealthlink@gmail.com. So now let's get started and talk about community action. On tonight's action agenda for the Public Health Link, we have a lot of information to cover. I definitely want to stress with you, pretty much like I do every episode, that don't forget to look at the links and resources that are provided at the end of the segment, as well as in the description of the webcast. It's going to be very important, especially tonight, so that you can look up additional information, such as recall information, after the episode. So let's get started. So we're going to talk about nicotine gummies. We're going to talk about Denver launching a campaign that's against mental health stigma. And we're going to discuss a consumer advisory by the Michigan Department of Agriculture and Rural Development, or MDARD. So in August, the Food and Drug Administration, or FDA, issued an alert regarding the legal sale of nicotine gummies. And the picture you see in front of you is of the nicotine gummies we're speaking of. A Florida manufacturer was producing a gummy product containing nicotine without having gone through an approval process to ensure its overall safety. There's certain measures that a product, especially nicotine-related product, has to go through to make sure that, for example, that when it says there's a milligram in each of those squares or each of those gummies, that actually is the case. There's certain quality assurance that has to be shown that that one gummy may not have 5 milligrams and one may have 1. Okay. So, quote, clarifying the FDA's authority, and this was a law that was actually just placed into effect, and I should say started this past April in 2022, clarifying the FDA's authority to regulate tobacco products containing nicotine from any source. So this was something that just started saying, hey, the FDA is going to be the one overseeing these products. This law gives the FDA authority over products made with non-tobacco nicotine, including synthetic nicotine, and imposes requirements under the FD&C Act for manufacturers, importers, retailers, and distributors of non-tobacco nicotine products. Why am I telling you this? Why did I quote that? Because if you have concerns about additional products, you know where to go to. You're going to want to check out the FDA website and see what they have to say on that particular product. So the agency, in referencing FDA, said it's working as quickly as possible to review nearly 1 million marketing applications as it's received from 200 companies. So in other words, another potential important aspect of tonight's action agenda with these nicotine gummies, you may come across a situation like what happened here, that this company went ahead and started selling without prior approval. You may come across it before the FDA has had a chance to say, oh no, you can't do that. You haven't gone through it yet. Additional concern with this type of product is being marketed to children. Look at, like, this one's called Cherry Bomb. Okay, these are gummies, and even a child accidentally getting into it. So each chew has approximately 1 milligram of nicotine, as you can see here. They contain 12 gummies, and they come in flavors of blue raz, or they did come in flavors of blue raz, cherry bomb, and pineapple, because the FDA sent them a letter. And if you go here, so here's specifically from the FDA, and you can actually click on this link right here. So I can click on this link that's right here. You can see the underscore, it's a hyperlink that will take me right to the actual letter to see what they issued to this company. Okay. to give perspective, 1 milligram. So when I talk about 1 milligram and why this is such a big deal, 1 milligram is all it takes to cause signs of toxicity in children. It's average of 1 to 4. So one of those squares, depending on the age and the weight of the child, can be enough. And the most common signs of nicotine toxicity can be vomiting and diarrhea. That's the most common. However, you can also have symptoms ranging from abdominal pain and sweating to headaches and seizures. If left untreated and or depending on the amount ingested, nicotine toxicity can also lead to coma and death. So I did put in here, this is the Cleveland Clinic, and they actually go through the symptoms, okay? I'm just going to scroll down here. So you can see the symptoms of nicotine toxicity, and I should say most common symptoms. If you are concerned about toxicity, if it's medically safe to do so, one of the places you can reach out to is poison control, and I have the number here. The reason why I'm saying if it's medically safe, if your child is incredibly ill, then take them into the emergency room to be treated. Don't stop and call poison control. Hospitals can reach out to poison control on their own as well to see what they can do for toxicity situation. After the company, according to the company's website, they've since discontinued production. And I did look this up myself to see. It says discontinued on it. But I want to bring up some points here. So the reason why I'm discussing this is multiple reasons. Is one, to be aware in case you have the product in your home, so that you, or maybe you know that someone that does. This was not an approved product. They have not gone through to make sure the quality assurance that what they say is in each gummy is in each gummy. Number two, discuss the concern for marketing a product towards children. They're gummies. How easy it'd be for a child to see something like this and think it's candy, right? 3, how to identify and who you can turn to in regards to nicotine toxicity. So in addition to just being aware of the signs and going to a website like the Cleveland Clinic, you have the number for poison control as well if you need to reach out to somebody with questions. And number 4, to talk about the role of the FDA improving nicotine products. So if you have any doubts or concerns in the future, you now know who oversees these products as well, so that you can look up information and reach out to them as needed. So another actionable item we're going to talk about tonight is the fantastic mental health program that's trying to end stigma, okay? So I want to start off with something. The Oxford Dictionary defines stigma, quote, as a mark of disgrace associated with a particular circumstance, quality, or person, end quote. Think how powerful those words are. Stigma is applying something to a person that may be very difficult or, depending on the circumstance, almost impossible to break. We need to do what we can so that we can end stigma, especially associated with mental illness. So the Denver Department of Public Health and Environment, they created a campaign, and the campaign is called What You Say Matters. And it's to encourage Denverites to have a positive conversation about mental health and encourage conscious behavior around words spoken. Sometimes we say things we don't realize the negative impact. It's not deliberate, it's not malice, but it's how it can be received on the other end. Mayor Michael B. Hancock explained, and this is a quote from him, "Many in our community are struggling with their mental health, especially over the past few years. We need to do everything we can to make sure our friends and family get the help that they need. That starts with reducing stigma. This campaign elevates the voices and stories of who've been impacted by stigma around mental health and shines a direct light on the lived experiences for people with mental health conditions." The What You Say campaign launched this month in print and digital advertisements across Denver. Additionally, What You Say Matters offers resources to the community to learn more about mental health stigma and fight back. I was just very impressed with the program when I came across it, and I'm going to show it to you. So this article talks about it. This was a press release. But I'm going to go to the actual site. So again, What You Say Matters is the name of the program. When I click on it, and you can see like this is the intro here. If I hit next, it actually discusses some of the phrases or things we may say where we don't think about it. We don't think about how it could be received on the opposite end. So it gives an example of using a mental health condition as an adjective. So they give examples are the weather is so bipolar, or you're being so OCD. So if you're somebody with either one of those conditions, or even think you might be, and you're hearing that, how may it affect you with wanting to continue or seek out treatment, right? So it says, instead of saying that, let's try saying something different. Use a condition as an adjective can minimize or stigmatize someone's experience. Try saying what you mean without comparing it to behavioral health condition. And they go through and they talk about anything from being, disrespectful to minimizing to invalidating or being dismissive, and what you can say instead so that we can encourage a much more positive interaction and not accidentally say something that could be very upsetting or encourage someone not to seek treatment if needed. And the Mayo Clinic, I want to go here as well, gave some fantastic information about overcoming stigma. So as community members, what can we do, right? Denver's focused on what can we do to make a more inclusive environment. And the Mayo Clinic talks about on the receiving end. On the receiving end, what it can mean, what can stigma cause, and how do you cope with it? So they give examples are some harmful effects of stigma include reluctance to seek help or treatment. Bullying can be health insurance that doesn't adequately cover your mental health treatment, or it could be the belief that you'll never succeed at certain challenges or that you can't improve your situation. That is the harmful effects of stigma. Imagine saying something that you think is innocent, not a big deal to you, but instead could be perceived as bullying to the person, or could mean that they look at it, they can't get past this moment. They're not able to succeed. So how do you cope with stigma if you're on the receiving end? Well, get treatment. Don't let that stop you from getting treatment. Don't equate yourself with your illness. Join a support group. And I would say, one of the most important is speak out against stigma. There's probably someone else that feels the same way you do. So can you imagine how empowering that would feel to discuss how you overcame it? What can you do to help someone else get through that moment too? The more we speak about it, the more we reduce stigma. So these links again are posted at the end so that you can access them as well. And I just want to stress with you that the more inclusive that we can be, the more that we can encourage people to get help, the more positive our interactions are going to be in our communities. So our last community action agenda item is about a consumer advisory that was put out by the Michigan Department of Agriculture and Rural Development. So as you can see here, or what's called MDARD, urges consumers to dispose of Country Gardens products because of possible health risk. So on October 3rd, the Michigan Department of Ag and Rural Development, or MDARD, issued a consumer advisory regarding produce that may be contaminated with raw, untreated human waste. Quote, during a routine public safety inspection, MDARD staff identified that Country Cupboards was using raw, untreated human waste on the fields where produce was grown for sale to local grocery stores and direct sale. MDARD explains in the advisory that although no one reported any illness, quote, if not treated professionally, human waste and other body fluids can spread dangerous and infectious diseases such as hepatitis A, Clostridium difficile, E. coli, rotavirus, and norovirus. And they sold to the Country Gardens sold to multiple establishments across the mitten. So if you're not familiar with Michigan, we tend to say, where do you live at here in the mitten? So they sold to multiple establishments on the mitten of Michigan. And I want to show you, they show on the advisory, here's some of the establishments. So we have some that are down in Rochester Hills, Ann Arbor, Ypsilanti, all the way up to Traverse City. So it's very important. This is definitely look at the links that are at the end so that you can see if any of these establishments are ones where you may have brought produce. So consumers are encouraged to contact the farm or facility where the product was purchased, and their instructions on disposal and refund. That's who you would reach out to. If consumer has additional questions or concerns, they can contact MDARD. So at 1-800-292-3939. And this is actually in this right here. Okay, so I'm going to highlight this. So in that press release, that information is actually provided right here. So we can actually see that. They're available Monday through Friday, 8 to 5. And they're urging any individuals, like if you're having symptoms of nausea, vomiting, diarrhea, jaundice, so that means that your skin is a yellow in appearance, fever, abdominal cramps, loss of appetite, weakness, headaches, or other symptoms, those are all symptoms of foodborne illness, then to seek medical advice, but definitely also reach out to the Michigan Department of Ag and Rural Development. Now, why, this was a very important deal to find out when they did their inspections, because although MDARD listed 4 or 5 illnesses, there actually can be quite a few in detail, and I wanted to show you. This is actually from the Indiana Department of Health, and they list all the diseases that can involve sewage. Remember, the Michigan Department of Ag said that this was untreated, so this would be sewage, okay? You can have cryptosporidiosis, E. coli, can cause encephalitis. I mean, you can see the list here that could be on. That the concern is, even if the person that had produced that matter appeared healthy, doesn't mean they weren't necessarily shedding something. So it's a pretty big deal to see this. So thank you for joining me on tonight's action agenda, and don't forget to check the resources. On tonight's Tech Corner segment of the Public Health Link, we are going to talk about tattoos. I'm sure that this is something you probably never thought we'd ever be discussing on a public health webcast. And I have to say, I was pretty surprised myself. There are some advances I had heard about with using tattooing, but when I came across this article, I decided, well, let's do a little bit of searching to see some other examples of how our tattoo is used in public health. So it was pretty interesting to see tattoos being used to improve the quality of life after breast surgery due to breast cancer, or for blood type codes and disease labels such as T1D for type 1 diabetes, and microneedle tattoo patches for vaccine delivery, not to mention as a means to monitor health issues. All of these things either are in play or are being studied for a potential use at some point in the future. This article is what actually had started it for me. And it was really interesting to see about the discussion about not only using tattoos to deliver a vaccine, and they give an example of the polio vaccine, but it would also provide like a UV light that will essentially tattoo the person that they've been vaccinated. It'd be a way to keep track of somebody where they've been vaccinated and the fact that they have been vaccinated. It was just such an interesting way of looking at it, that not only how much easier it would be to you get the vaccine, but then you have a way to keep track of that you received it. Think about the records you have to carry around with for your COVID vaccines as an example. So I was incredibly intrigued. But the other one I want to show you, because as I said, when I dug into this article, and please definitely look it up when you see the links at the end of this webcast. But this made me want to look into more, like, what other ways have we used tattoos? Well, this just totally blew my mind. And this was being researched in 2019, still under research from everything that I had found. But this is using tattoos to help monitor someone's health status. So what you're looking at here are tattoos that essentially change color to signify potential levels of glucose, albumin, and as well as pH. Now, this is still under study. This is definitely not to the point of being able on widespread use. But it was interesting to see that they explain in here that albumin carries protein in the blood. Lower levels can indicate kidney or liver issues. On the other hand, high glucose levels can indicate diabetic issues. Now, if you know anything about diabetes, it has a potential to affect kidneys, for example. So when you're talking about something that is not only giving you glucose numbers, but also potential signalment for organ involvement, that's big, especially when it's a tattoo that has potential to change colors. Now, the study at this point, when this was recorded, explained that there's still hurdles to overcome. And you can see here under the pictures, I'm going to talk about those images in just a moment. But for one, only one of the 3 tattoos are reversible. So while the pH sensor can shift time to time, again, albumin and glucose tattoos only shift once. So we need to figure out a way that obviously doesn't just signal one move, because in other words, it could say that there's not a glucose issue when there is one, because it's an old reading, so to speak. However, to think that we are moving towards a direction of being able to look at someone, and not necessarily, it may not be a way of saying this is exactly the reading for glucose, but it will at least give a potential signal of, okay, I need to do another step here. I need to eat, or I need to move towards some steps towards wellness because my body is showing this shift or this change in my glucose. I need to eat, or I need some sugar input of some kind, or so on. So can you imagine the implication that this could have for people that have life-threatening diabetes, that could have a change any moment? I was just so impressed to think about tattoos being used at this capacity for public health. I really hope that you take a look at the links. I also provided links for the use of tattoos for women that have had breast reconstruction surgery after breast cancer. And this first article that had caught my attention discusses other ways for how tattooing has been used for public health purposes. So thank you for joining me in tonight's segment of the Tech Corner. Hello and welcome to the public health event segment of the Public Health Link. So tonight, what I'm going to discuss with you is actually a month-long event or month-long awareness, and it is for Breast Cancer Awareness Month. Now, I do want to comment on is that this awareness month is not just for women. Men can also get breast cancer. So this is not a black and white or only for women. I just want to be very clear that this is also something that we should be discussing with men too, that when there's something suspicious that they discuss it with their physician so that they catch things early, okay? So let's talk about the key statistics. How common is breast cancer? Well, it's estimated by the American Cancer Society that about 287,000, almost 288,000 cases of invasive breast cancer will be diagnosed in women just this year alone in 2022. That over 43,000 women will die from breast cancer. Again, we're only talking about 2022. And there was an incidence rate increase of 0.5% per year, which is actually a pretty large number. So breast cancer is the second leading cause of cancer death in women. Only lung cancer kills more women each year. And the chance that a woman will die from breast cancer is about 1 in 39 or 2.5%. Now, these statistics should be pretty sobering. And I'm going to provide you some action steps that are not only for you so that you can learn more, maybe for yourself or for your loved ones on cancer and what you can do to prevent it, but also some actionable steps to get more involved in your community to help and support those that either may be going through cancer, breast cancer, or just to support organizations that support those families. So I'm going to go to the Breast Cancer Awareness Month page that's for the National Breast Cancer Foundation, Inc. And I highly recommend for you to check this out. I'm just going to focus on a particular image here. So this is the calendar. I click on it, it's going to enlarge it, okay, so that I can see it much better. Let me do this. Okay, let me enlarge this just a little bit more. So what's really cool about this calendar is it's not just what you can physically do, but it's really showing like a months-long version of mental exercises too. And what I mean is, it could be reading more about breast cancer. It could be getting a better understanding of your risk for breast cancer. It could be reading the stories of those that have survived. So it's really more so about the journey, about more of an internal journey during this month of awareness. And I was so impressed because I can click on these different links here. If I scroll down, and I'm going a little bit slow just so you can see it so it's not a flash and hopefully not making you nauseous. If I scroll down, I can see here that it explains more in detail each of those dates and what you can do, okay, or during those awareness times. And it's done like this for the entire month. I was just very much impressed because physical action, which is what the Public Health Link is about, is great. But some kind of mental knowledge builder is fantastic too, because that is what helps you when you come across a situation. Maybe you encounter somebody that was newly diagnosed, you have these resources in the back of your mind that you have some recommendations for them and support. It's something that we've put ourselves through a mental exercise so that we can help others if and when we encounter those kinds of circumstances. So there's also through the Susan G. Komen Foundation. Now I already have it pulled up for Michigan. If I click on this, it'll take me to their webpage for their entire organization. What I encourage you to do, of course, is to do that, but also look at your own community. So on the homepage, and I can also do that here, I would click on in your community and I can enter my zip code or the state. This allows me to see what they've done here in Michigan. It allows me to see any kind of events, how to get involved, more information and statistics about here, in my own state. In addition, if I scroll down, I can see events. I can see what are they doing for this month. How are they spreading the word about breast cancer awareness? And I can see all different kinds of fundraisers and other types of informational events that I could be part of. And I can also register here on site. But I also want to show you something else that's really great about this page. I'm going to scroll all the way up to the top. What if I'm looking at this and I go, you know what? I did not realize how common breast cancer was. I don't have anybody in my family with it. I haven't really known anybody with breast cancer. But now that I know this, I really want to see how I can give back. How can I support an individual that's been diagnosed or their family? Well, you can volunteer. You can actually submit a form to volunteer through the Susan G. Komen Foundation. So towards the top again, you can see where it says volunteer. I click on this and I can click on sign up to volunteer today. And it will take me to this page here. So basically I'm submitting a survey to say anything in particular that I want to volunteer for or with. And if you don't know, there's a spot for that too. It says, I don't know, or maybe I'm willing to be placed wherever it's needed. I can put that information in here, the hours of my availability and my contact information. And somebody from the Susan G. Komen Foundation will reach back out to you. So this is a really, informative website that not only can help you look at ways of, I can be part of this fundraiser, or I can recommend it to my loved ones that, there's a fundraiser for the awareness month of breast cancer awareness month. But I can also look at ways that I can be more active within my community and give back to either those that have cancer or going through treatment, or to support their families with that process. So thank you for joining me on tonight's Public Health Event Corner. Welcome to the Public Health Meter segment for the Public Health Link. So if you remember, for the Public Health Meter, what I do is I take a look at a subject matter, and on a scale of either acidic to alkaline, really look at how actionable that subject is. If it's acidic, it means that it just really encourages you to do nothing. Like it's not going to push you to do any kind of action whatsoever. If it's neutral, if it's a 7, for instance, then that means it's information only. And that's not bad. It definitely, information's a starting point, right? So it could be neutral. If it's alkaline, that means it's really encouraging to do something. Like you hear this and you're like, okay, I'm ready to hit the ground running. What can I do with it? So for tonight's segment, for the Public Health Meter, I'm really going to be talking about something that is going to be useful for teachers, for parents, including parents that homeschool their kids. And this is a program that you can find under the CDC that's primarily for the ages of junior high and high school students. And it's the Junior Disease Detective, okay? It has everything from a comic book. So this is actually a comic book, and I can show you this. And while I'm waiting for it to open up, I'm going to continue on showing you the rest of this page. So I can look at a comic book. I can look at actual activities. It breaks it down by age. So I can decide if this is something that's going to, fit the age of the students maybe that I have or of my kids. And it really it's absolutely action oriented. So before I click on one of these activities so you get to see it for yourself, I'm going to go back to that comic book, and I want you to see, I'm just, as an adult, I'm just eating this up. So it goes through this comic book is pretty cool, just so you can get a look at it. The graphics are pretty impressive, I thought. So it gives us something for that's entertainment along with some fantastic information about disease investigation. Okay, so I'm going to go back to, and you can download it and you can actually order. There's a link up here where I can actually order this, and I want to tell you, if you weren't familiar, you could do that. There are lots of other supplies that you can actually order through the CDC. USDA, or United States Department of Agriculture, has some materials as well. There's different agencies that you can order supplies through. It doesn't cost you a dime, and it can be shipped to your classroom or your home. So I'm going to go back down for a moment to these stories. So I'm going to click on Activity 3 because this is one of the newest ones, Hamlet's story, because I want you to be able to see it for yourself. This walks you through the age that this is primarily for, how long it will take you to go through with your class. It talks about what are your objectives, what are your definitions for what you're doing, how do you conduct this within your classroom setting, even additional links that you can use for the activity as well. This is a really good website for teachers to look at ways to explain infectious disease. Now, I think, especially after COVID, students have an awareness and understanding they probably have never had before. With understanding, for example, something being airborne, which is why you wear a mask in a public setting. That could have been something that had never been discussed before in a junior high or high school class. But this could still give a different understanding because it's a different type of disease that's being discussed. But since now the students have been part of something, your conversation might even be deeper, that among themselves, a deeper conversation. So this covers everything you would need to do within the classroom from start to finish to get as much out of this as absolutely possible. Now, I've done something similar as a substitute teacher years ago. The CDC had supplies and information like this before, and I just felt like it was a wonderful tool. And it actually provided me with a way of kind of brainstorming and going, oh, how else can I broaden the information they're providing? So as an example, that accompanied this type of information, I actually asked an infectious disease doctor from Michigan State University to do a Skype call with the class. So they were able to participate in an active setting within a group like what this is doing here, and then they heard from a professional reinforcing what they had learned during the activity. So it really encouraged me to brainstorm basically, and how can I make it even more deep, the activity. So I just found that this was a really great actionable item that can encourage teachers to look at how they can talk about infectious disease within their class, that can also encourage parents to discuss it with their own kids, such as with this comic book, right? They can read it at home. How many kids have tablets or even the phones that would be able to access that PDF document? So on my scale, so here is my pH meter scale. So we have acidic, we have neutral, and we have alkaline, right? So on my scale here, for the Junior Detectives series on the CDC, I feel like I should have a drum roll for this, but I gave it a 9. I was just very impressed with the fact of it's a way for kids to get involved in this too. Kids to have a deeper understanding, not just be told. I think it's important that we have public health professionals telling us at times what we need to do, absolutely important. But also providing that additional information allows adults, or in this case, kids, right, to see a red flag and act on their own. It allows definitely for some proactive movement. So because they have a better understanding. And this is entertainment. It's entertaining as well. It allows them to physically be a part of this process with other students. So the only reason why I didn't give it a 10 was because it's only junior high and high school. I do think this would be very beneficial to start teaching kids even younger than that. Because when do we start teaching kids to wash their hands, right? I mean, that starts way before junior high, or it should be. So I definitely, if this would have been geared also towards younger students, I would definitely absolutely said this is very alkaline, very much get up and go, and I would have given it a 10. So thank you very much for joining me on tonight's pH meter for the Public Health Link. As we come to a close on another fantastic episode of the Public Health Link, let's talk about some of the items we discussed tonight. We talked about the FDA issuing an alert over companies selling gummies that contain nicotine. We discussed a campaign in Denver to help end mental health stigma. And we discussed an alert that's issued by the Michigan Department of Agriculture and Rural Development. For our Tech Corner, we discussed tattoos. For our public health event, we discussed October being Breast Cancer Awareness Month. And for our pH meter, we discussed a CDC website that aims in providing information to teachers and that will allow them to have activities surrounding diseases, disease prevention, and similar activities for junior high and high school students. The entire point of the Public Health Link is to allow a webcast to provide to you information about public health activities that you can apply in your homes, in your communities, your workplaces, or schools. It's to create a public health outlet of actionable items. Knowledge doesn't mean anything if we keep it to ourselves. So don't forget, too, that for future episodes to hit subscribe so that when they're released on Sunday or during the week that you're alerted of those releases. In addition, if you have any ideas for future episodes or for public health events, please email thepublichealthlink@gmail.com. Again, that email is thepublichealthlink@gmail.com. So as we end tonight's episode, I want to ask you one question. How can you contribute to the health of your community? So I'm signing off, Marisa Salisbury, on this October 9th, 2022 episode, and I'll see you next week on the Public Health Link.